An emerging concept for the information technology in healthcare is the idea of a Health Information Exchange, or HIE. This idea has been around for many years, yet has not gained considerable momentum in this time. The idea behind HIE is that a patient's healthcare information will be documented and stored electronically by all providers and services within our nation's healthcare system, regardless of the organization or individual providing care. The HIE provides a common database allowing access of patient health information throughout the U.S. to maximize patient safety, provide better outcomes, and deliver continuity of care amongst all healthcare providers. This technology must provide a standardized, interoperable model that is patient-centric, trusted, longitudinal, scalable, sustainable, and reliable. Relative to IT advances that have occurred in the past decade, it would seem that this idea is easily attainable, but many barriers still exist. There are many challenges to the creation of a state or national health information exchange. For starters, the workflow within the healthcare system must be able to manage the data input requirements needed for storage of this information. Patient privacy rights, better known as HIPAA, make exchange of data, especially electronic data, challenging as well. Another major challenge is the integrity of data. Imagine that your doctor pulls information on you that is actually that of another individual. In this case, the entire argument for HIE benefits are not only compromised, but could actually result in harm. Another challenge is a universal platform for information exchange. Currently, there are dozens of different vendors that store electronic health information for various organizations and providers. With this wide range of variability comes increased barriers for information exchange amongst systems. Even if a common platform is developed that would allow the flow of information among systems, there are still major threats to the privacy and integrity of the data. Once established, strict adherence to legal standards must be in place with methods for auditing and monitoring systems to assure that patient health information remains private. In terms of Gartner's hype cycle, health information exchange is in the slope of enlightenment. Much of the infrastructure for creating the HIE is in place, but the adoption hinders upon the challenges that I've mentioned. This idea of an HIE is clearly accepted within the healthcare community, but has not achieved universal adoption at this time. So what does the future hold for health information exchange? I feel that the adoption of this technology is inevitable. How we get there is another question. It is likely that government regulation will be needed to push this technology to the next level. The Affordable Care Act has virtually required that organizations and providers adopt electronic health records. Even with the incentives and penalties for electronic health record adoption, it will be several years before the vast majority of health information is captured electronically. The ability to capture and store this information is the foundation for HIE. Once electronic health records are widely adopted for all healthcare services and providers, then HIE only needs to overcome the other challenges that I've mentioned. It is likely that incentives will be needed for this to occur since the expense and challenges for universal agreement are so profound. Unlike many technologies, where the consumers are willing to pay a premium for superior services, healthcare remains a secondary target in this realm, despite the profound impact on individual lives. Americans have no problems paying hundreds of dollars for an iPad, but yet they don't see the immediate impact of paying for improved health care through HIE. I expect that a governmental push for HIE will occur in the next 5 to 10 years, with mass participation occurring shortly after Medicare requirements and standards are in place. The benefits will be profound for everyone accessing health care in the United States.